There is a term that hasn't been used for um, a few months that I'm aware of. It's a term that has been used quite heavily um, for the past probably 3 or 4 years. Um, well, maybe even 5 years, ever since President Barack Obama has been in office. It is the term redistribution of wealth. And it's that I've got a few thoughts on this morning. Um, Essentially, uh, ever since the Obamacare uh, has come up and has been passed through the House and the Senate and has become the law of the land, um, that has been the primary focus rather than the redistribution of wealth. And I'm here to tell you that it's the same thing. Obamacare um, is a nightmare. It is uh, it is the redistribution of wealth. Part of Obamacare is the removal of caps on your copays and your deductibles. And so, in other words, if you have cancer or something, or for instance, leukemia, sure you might get coverage, regardless of your pre-existing condition or whatever. If you had coverage before this, your deductible, based upon your plan, who knows, it might be $10,000 or something, tops or something. I'm not sure. But if it was $10,000 under Obamacare, your uh, your open cap, if you will, which doesn't exist, it can easily be upwards of $30,000. And we have a lot of sick people in the United States. Anything from diabetes to cancer, heart conditions, whatever. And so Obamacare is going to be extremely expensive, and it's already being felt. And so it is just important to note that insurance companies, it's going to be a blessing to them not having these caps on copays, because they need to finance Obamacare somehow. And the only way, one of the ways that they're going to be able to do that is through, the copays, and those are already skyrocketing. I've already had a couple people approach me about their own personal health care. And one has a pre-existing condition, and it is a cancer, and one does not. And we are 2.5 months away from January 1st of 2014, and they have each received letters already from their insurance carriers. And the scenario I gave you about leukemia is similar to what this gentleman told me. His copay is about $3,500 a year, and he has a written notification from his insurance carrier that as of January 1st, under the ACA Affordable Care Act, he will no longer have that policy, but instead his copays to have the same coverage is going to go up to about $20,000. That's a huge, for a lot of people, that's an entire uh, year's wages. And so there's a lot of things about Obamacare that is disgusting. Uh, we are paying for Planned Parenthood. We are paying for maternity leave. These things are built into Obamacare as mandates. They are the law that everyone's going to be paying for, even though it's not something you need. I don't need maternity coverage. And so that's what this comes down to, is the redistribution of wealth. And as I have said it before, this comes down to votes. And that's what the political landscape in the United States has come to, is that we are willing to do anything to gain the favor of the majority vote. Unfortunately, and this has been proven in the last couple of elections, you're going to get a majority vote out of the inner city. Those that definitely the unemployed, uh, the low wage, and not to diminish their vote, but they are an easy segment of society to cater to romance to. Uh, I tell you it's easy because all you need to do is promise uh, these folks some very simple entitlements, and it's human nature that if you are down on your luck, or you are lacking means, it's human nature that when you are handed a silver platter, to accept it, to say, okay, I'm game, I'm with you, I'll jump on board. And breaking the habit of non-independence, non-self-reliance is very difficult. It requires a severe sacrifice on the self, on the part. And that is what has happened here. Uh, this segment has been handed a golden platter. You will have health care. Just vote for me. You will be taken care of. You will have entitlements. You will have an unending food stamp balance, whatever. And that is what has happened. And that creates a society of apathy, because it makes you dependent on the government. And that's how things are working. That's how things are functioning. And it's a very touchy thing in American politics, because it pulls at the strings of human nature. Human nature will dictate that if you see a path towards power and authority, your mind is going to, without discipline, your mind is going to want to go in that direction. And that is what's happened here. We've got, on all levels of government, we've got people that have seen the opportunity to gain a vast amount of votes just by promising certain things to a certain segment of society. Human nature, yes, but that shows that we have a government without discipline. Can't even balance a budget. Can't even propose a budget. So this is what Obamacare is. And I just want to make that very clear. It's the redistribution of wealth, which is not what America is all about. We are provided under the Constitution of the United States the ability to pursue our happiness, the ability to provide for our families, to provide for the means to support them to acquire wealth, to be an influence, to be a business person. And hey, it's interesting. Given our existing system as it is, we are still by far the most charitable, the most compassionate, the most humanitarian giving country in the entire world. Which means if it's not broke, don't fix it. We as Americans are still the most generous people on the face of the earth. And I don't say that with a prideful attitude. I'm saying that to illustrate that we as Americans know that we have a lot of wealth in this country. It is done through capitalism. It is done through our hard work, our ingenuity, and we have a lot of wealth, and we feel it in our bosom, the need and responsibility to uplift and enhance the lives of millions of people around the world. And we do that. And we do that willingly. We are not mandated, we are not forced to take our wealth and distribute it among those whom we have not chosen to help. It is very important to exemplify and magnify self-reliance, discipline. I, as much as anyone else, understands the need to help other people. But you do not give things away that are not yours. You do not provide phone cards or benefits to people that aren't willing to do something to acquire it. You just don't give it away, because that is theft. That means you are giving away something that you have taken from somebody else against their will. It may be by law, but that shows that the law is flawed. It shows that the people who pass that law are flawed. And that's what's going on here. We are providing health care to everyone in this nation. And that sounds all well and good. But it comes at a severe price. People can come in with any kind of condition pre-existing. It may even be and will be self-imposed conditions, drinking, drug use, whatever, and they will get health care. And they will get health care billed on you. And that's why your rates are going to skyrocket. You are going to be taking care of drug users. You are going to be taking care of, and I don't mean to say this to belittle those who actually do need the help. But I'm also telling you that there are avenues out there already existing to gain help. You don't need to reinvent the entire healthcare system to find that help. You don't need to place a burden on everybody else, on the rest of America, in order for you to find help in your medical situation. And that's what we've got going on. So this is my warning to everyone that redistribution of wealth is here. It is a socialist concept. It is a failed concept because it diminishes a person's ability to thrive and pursue happiness in this nation.